Hi, this video presentation is for MFT6102, Week 3 at North Central University. My name is Angela Scoggin. I'm going to evaluate a character and develop a treatment plan based on one of three movie choices. I chose A Beautiful Mind with Russell Crowe playing the role of Dr. John Nash, Jr., a Nobel Prize winner in economics, a mathematician, as well as a lifelong sufferer of schizophrenia. Excuse me, my notes are to my left, so I will glance away from the screen momentarily. First, I want to give you quite an overview of how the movie portrays Dr. Nash. However, I do want to add that this is a Hollywood depiction of Dr. Nash's life, and some of his life events have not been included to make the story more entertaining. The movie shows the journey of Dr. Nash, beginning with his orientation at Princeton graduate school. The scene does show Dr. Nash as an introverted young student that isolates himself in the back of the room. He was accepted to Princeton and won the Carnegie Scholarship. The math department at Princeton was highly competitive, as other students described Dr. Nash as the illustrious Dr. John Nash, the winner of the other Carnegie Scholarship. And that student was Martin Hansen, who also was the second Carnegie Scholarship winner. Even though it is apparent that John Nash is different from his colleagues, he does not show normal social cues. He doesn't have very many personal relationships, and his main relationship in the beginning is his roommate, Charles Herman, who later becomes his best friend. Nash struggles with his inability to determine his doctoral topic, while the other students have been published, and that he considers him a much higher standard compared to the other students who he calls mere mortals. Nash later develops the game theory that contradicts over 150 years of economic theory after an experiment that he does in a bar called Ignore the Blonde, or Governing Dynamics. His theory gains him a position with Wheeler Labs at MIT, which is where he meets and later marries his wife Alicia, who is a graduate student as well. She does show Nash that there are other ways to figure out a solution to a problem, despite his social ineptness. While he's at Wheeler, Nash is called to the Pentagon to crack the codes the Russians have been sending, and on his second visit, Nash first sees William Parcher, who's from the CIA. Parcher later approaches Nash to help break codes for the Russian secret cells in the U.S. and that they have bombs that they need to have found, so Nash is going to be a spy for the DOD. Because of Nash's inability to understand normal social cues, he is unsure if he should marry Alicia, and Alicia does explain the love theory in ways that Nash can understand, and the two are later married. Nash does decide that he must change his role with the CIA and Parcher because Alicia becomes pregnant with their child. This sends Nash into the beginnings of a psychological break and starts believing that the Russians are after him and Alicia must go live with family, her sister. While a guest speaker at Princeton, Charles appears with Marcy, Charles's niece, who Nash has met previously. During the lecture, men in dark suits and hats arrive at the back of the lecture hall, and Nash is convinced that these are Russians coming to get him because he's a spy. Over time, Alicia has watched Nash digress and slowly distance himself from reality, and eventually she realizes Nash does require psychiatric care. This is the first time Nash is institutionalized by Dr. Rosen, who actually is the men with the dark suits and hats. Nash believes Charles has betrayed him as a result of this, and Nash undergoes insulin treatment and electroshock therapy, which, based on his actual biography, is not shown in the movie. Dr. Nash does go through this treatment. After the institution, Nash becomes very isolated and withdrawn from society. not venturing outside, and Alicia is his primary caregiver. Over time, Nash begins to stop taking his medication because he feels it has blocked his inability to break codes or work, as he still believes his hallucinations at this time are real. He begins breaking codes again when Parcher comes to his home, and they have a secret location in a shed. Alicia later finds the shed while she's leaving their son in Nash's care just for a short time. She does find the same newspaper clippings and line drawings that she had found when she went to his office at Wheeler Labs. Alicia returns to find their son in a bath filling with water, and Nash had claimed that Charles is watching their son. After the incident with the son in the bath, Parcher, Marcy, and Charles all collide, and Parcher threatens the life of Alicia with encouragement from Charles. This is when Nash realizes that Marcy doesn't ever get old and that she's not real. This is the first breakthrough Nash has that he is seeing hallucinations. Alicia and Nash agree to work through his illness without medication. Nash learns how to ignore hallucinations despite the fact that he continues to see them. Nash slowly re-enters himself into the academic community by asking for a position at Princeton, where he just works from the library to begin with, and later returns to teaching students. At the time, he goes to his previous colleague, Martin Hansen, who is at Princeton at this time. Later, he is chosen to win a Nobel Prize in economics. And during the interview, he is surprised by a display of appreciation from his other colleagues by giving him their pens, which is a sign of true professional accomplishment. The movie does an excellent job in highlighting the burden of a psychotic illness has on the sufferer and their loved ones. A Beautiful Mind is an accurate demonstration of the symptoms and struggles faced by those who live with schizophrenia. Now that I've explained the overall view of the movie, I will now go on to create the diagnosis with some supporting evidence, give descriptions of the disorder, and provide a treatment plan. I will discuss the systemic effects of this, as well as the effects on the individual John Nash, and provide 2 other articles that support my diagnosis. Diagnosis and supporting evidence. In the DSM-5, schizophrenia is defined by abnormalities in one or more of the following domains: delusions, hallucinations, disorganized thinking, grossly disorganized or abnormal motor behavior, and negative symptoms. The symptoms I've concluded from the movie include delusions, hallucinations, grossly disorganized or abnormal motor behavior, and negative symptoms. Delusions are fixed beliefs about things that are held despite evidence that they are false. There are different types of delusions, such as persecutory, which is the belief that one is going to be harmed or harassed by a person or a group. This aligns with the movie. Referential, which is the belief that certain comments, gestures, environmental cues are directed at oneself. Grandiose, the belief that one has special abilities, wealth, or fame. Again, this is Dr. Nash. Erotomanic, which is the belief another person is in love with themselves. I don't believe this applies here. Nihilistic, which is the belief that a major catastrophe will occur. This is demonstrated in the movie. And somatic, which is the belief about one's health or organ function. And again, I don't believe this applies here. Examples of delusions in the movie are the persecutory, which is Nash believes that the Russians are coming to get him for being a spy, and that Parcher is going to kill his wife when he sees her as a liability. Grandiose, which is Nash has the belief that he is greater than the others at school, that he will have the truly original idea that will make him matter most, and that the others, again, other students at the school are just mere mortals. So this also attributes to his belief portrayed by Parcher that he is the best code breaker that Parcher has ever seen. The Mayo Clinic determines grandiose as believing they are special or unique, having special talents, abilities, or remarkable skills. This fits Dr. Nash. nihilistic. Parcher develops from the idea of the code-breaking bomb threat, and that Nash is the best code breaker he's ever seen. The threat is in the U.S., and it is Nash's job to locate where the sleeper cells are located and find the bomb. Parcher indicates they have narrowed it down from Nash's previous work to being on the eastern seaboard. Next is hallucinations. Hallucinations are vivid, perception-like experiences that occur without an external stimulus. They may occur in any sensory form, but auditory hallucinations are the most common, which is hearing voices. In the case of John Nash, he has visual hallucinations. Nash's hallucinations actually have taken on human form in 3 characters. First character is Charles Herman, and is Nash's college roommate at Princeton. First introduced in the movie as the prodigal roommate, has arrived. Charles becomes Nash's best friend, despite the fact that Alicia has never seen him or have ever seen a photo of him. Marcy, who is Charles's niece, who is later introduced in the movie, when Charles visits Nash at Wheeler and finds Nash sitting under a tree and introduces herself. The third is William Parcher, who is a CIA agent, first seen while Nash is at the Pentagon during his second visit, breaking the Russian codes. He is seen in the distance in the doorway by Nash, and Parcher later approaches Nash to be a spy for the DoD, puts him through a battery of tests, and implants a chip diode that gives off different number codes for a secret drop spot that can only be visible under certain lights. Next, grossly disorganized or abnormal motor behavior is defined as a range from childlike silliness to unpredictable agitation. Problems may emerge in any form or of goal-directed behavior, leading and performing activities of daily living. Catatonia is part of this. It's marked by significant psychomotor disturbance with catatonic behavior, marked decrease in reactivity to the environment. Nash is seen as abnormal behavior in that he does display goal-direct behavior when he gets completely engrossed in his work for Parcher. He has missed classes at Princeton during his time there, locks himself in his room for days, or is found by Charles in the library after 2 days trying to work on his doctoral topic. He works through lectures at Wheeler, which is how he does meet Alicia when she came to his office after he had missed the lecture, and then later his assistants consider him to be more agitated around the time that Nash does become institutionalized. His behavior could be considered catatonic in one scene when Nash is holding his crying son in his arms and doesn't seem to be fazed by it and seems to be completely unaware of his surroundings. Now, negative symptoms involve the loss of normal emotions and other functions of a severe restriction in their range and intensity. Examples of negative symptoms include diminished emotional expression, avolition, agoia, anhedonia, and asociality. I found that 4 of these examples of negative symptoms within the movie. 1 being diminished emotional expression, lack of emotion in the face or eye contact, movements of the head, face, and hands that give an emotional emphasis to speech. Nash usually didn't show much facial expression or emotion even when he was happy. He tended to lack eye contact, especially when he was more uncomfortable in certain settings. Nash was portrayed as having a habit to rub his forehead with the side of his fingers, something like this, and thumb. And then the second one was avolition, and it is the decrease in motivation in self-initiated, purposeful activities. Again, Nash was not involved in many activities outside of his studies and work, even though he is seen in the local bar while his attendance at Princeton. He went alone or normally with Charles. Anhedonia, which is the decreased ability to experience pleasure from positive stimuli, or degradation in previous pleasure experiences before, and Nash is unable to respond. Example of this is Nash is unable to respond to Alicia later in the movie when she makes advances on Nash to seduce him sexually. Excuse me. And then the last one I found was the sociality. It is the lack of interest in social interactions. This, too, is Nash not being very involved socially. There's a scene where Nash is trying to figure out an algorithm for pigeons in the courtyard, while others of his colleagues are playing games. He is enticed to participate in the game, later loses, and then leaves again, becoming more isolated. To meet the criteria of schizophrenia, the DSM-5, section 295.90 states, 2 or more of the following must be present: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and or negative symptoms, with at least one symptom being delusions, hallucinations, or disorganized speech. Also, they must show signs of the disturbances for a time of at least 6 months, with at least 1 month of active phase symptoms, and may also include prodromal or residual symptoms. The movie, however, doesn't show exactly the time frame that the hallucinations last, but they do begin at they are seen at the beginning of graduate school with his roommate and best friend Charles, and continue through at least the first few years when Nash makes his game theory discovery, and later again when he is at Wheeler Labs with the inclusion of Parcher. A significant portion of time since the disturbance begins, functioning in one or more areas has been well below the level of achieved before onset. This can be seen when Nash is seen as not taking care of his hygiene. Many parts show he had not shaved or appeared to have showered. He's wearing pajamas, his shirt is untucked, his hair is undone. He has very unkempt clothing. Fourth is the disturbance is not attributable to the psychological effects of a substance or another medical condition. Schizoaffective disorder or depressive or bipolar disorder with psychotic features have been ruled out because either no major depressive or manic episodes have occurred simultaneously with the active phase symptoms. For this criteria, I don't believe Nash falls into this category as he does in the first 3 criteria, at least in the movie. It doesn't really portray Nash as being depressed or diagnosed with bipolar or manic episodes being present during the active disturbance. In my opinion, it is my opinion that he shows more than one symptom, which includes delusions, hallucinations, and grossly disorganized behavior. Upon my further research, I did find an article by C.E. Zupnik, I'm not really sure how to pronounce that, of 2013 of mentalhealth.net, states that the changes of DSM-5 are as follows. For schizophrenia, Criterion A lists the 5 key symptoms of psychotic disorders, being 1 being delusions, 2 hallucinations, 3 disorganized speech, 4 disorganized or catatonic behavior, and 5 negative symptoms. Previously, 2 of the 5 symptoms were required. However, only 1 of the 5 symptoms was required if delusions were bizarre or if hallucinations included a running commentary on a person's thoughts or behaviors, and or 2 or more voices are conversing, which in Dr. Nash's case is accurate. This exception has been removed for lack of specificity and poor reliability. This change makes intuitive sense, and the notion that constitutes bizarre is kind of rather vague, and its removal reduces any cultural bias. So in DSM-5, 2 of these 5 symptoms are required, and at least 1 symptom must be one of those first 3, which is delusions, hallucinations, and disorganized speech. Okay. Next is a description of the disorder. Based on the Mayo Clinic, schizophrenia is a severe mental disorder in which people interpret reality abnormally. Schizophrenia may result in some combination of hallucinations, delusions, and extremely disordered thinking and behavior that impairs daily functioning and be disabling. Schizophrenia is a chronic condition requiring lifelong treatment without any definite cure at this time. According to the National Institute of Mental Health, schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality. Although schizophrenia is not as common as other mental disorders, the symptoms can be very disabling. Symptoms and signs of schizophrenia usually start between the ages of 16 and 30, and in rare cases, children can show signs of schizophrenia in their early teens. Based on the movie, Nash is in his early 20s when the symptoms start to appear while he is at Princeton for graduate school. These symptoms fall into three main categories: positive, negative, and cognitive. Excuse me. Positive symptoms are psychotic behaviors not generally seen in healthy people. People with positive symptoms may lose touch with some aspects of reality. Symptoms include hallucinations, delusions, thought disorders, unusual or dysfunctional ways of thinking, and movement disorders, which is agitated body movements. Negative symptoms are associated with disruptions to normal emotions and behaviors, and those symptoms can include flat affect, which is the reduced expression of emotions by facial expression or voice tone, reduced feelings of pleasure in everyday life, difficulty beginning or sustaining activities, and reduced speaking. Cognitive symptoms for some patients of schizophrenia are very subtle, but for others they're more severe, and patients may notice changes in their memory or other aspects of thinking, and these symptoms include poor executive functioning, which is the ability to understand information and its use to make decisions, trouble focusing or paying attention, and problem with working memory, which is the ability to use information immediately after learning it. There are several factors that contribute to the risk of developing schizophrenia. Some I found were genes and environment. Scientists have long known that schizophrenia sometimes runs in families, and however, there are many people who have schizophrenia who don't have a family member with this disorder. Many people with one or more family members with the disorder who do not develop it in themselves, actually. This is true in the case of John Nash and his son, but in reality, Nash actually had two sons, but only the son with Alicia was affected. Scientists believe that many different genes may increase the risk of schizophrenia, but no single gene causes a disorder by itself. It is not yet possible to use genetic information to predict who will develop schizophrenia. Scientists also think that interactions between genes and aspects of the individual's environment are necessary for schizophrenia to develop, and environmental factors may involve exposure to viruses, malnutrition before birth, problems during birth, using mind-altering drugs during their teen years or early 20s, exposure to toxins during brain development, during pregnancy, psychosocial factors, and the possibility of older male parenting during conception. Also, different brain chemistry and structures. Scientists think that an imbalance in the complex, interrelated chemical reactions of the brain involving neurotransmitters, substances that brain cells use to communicate with each other, like dopamine and glutamate, and possibly others, play a role in schizophrenia. Some experts also think problems during brain development before birth may lead to faulty connections. The brain also undergoes major changes during puberty, and these changes can trigger psychotic symptoms in people who are vulnerable due to genetics or brain differences. Effects of schizophrenia can include self-injury or harm to themselves, usually influenced by delusions to commit self-harm. Nash is found in the room at the institution looking for the diode that was implanted by Parcher, and he is suffering from the stress of an illness such as anxiety. He is seen looking for the diode in his arm that was implanted by Parcher. Also, the effects also suffer from if the sufferer suffers from the stress of illness from such as anxiety, depression, social isolation, and then throughout the movie, Nash is depicted as socially awkward. Others think of him as weird. Also, there can be aggression, but it is more uncommon. Despite the scene which Nash pushes Alicia, his aggression wasn't directed at her, but to save her from his hallucination of Parcher. Finally, the inability to work or attend school which we both see happens to Nash at Princeton and at Wheeler Labs. A systemic effect of schizophrenia can alter interactional patterns and relationships between spouses, whether they are heterosexual or homosexual, parent and child, and or the family unit. Most sufferers have met their partners before the onset of the disease, and it is extremely difficult for schizophrenics to form a close bond to others. They tend to close in within themselves and push others out. Because schizophrenia can change behavior and personality, symptoms make caring and loving the individual very difficult, and they will appear to be very cold and distant. Schizophrenia can make the individual act erratically and become very verbally abusive, can emotionally neglect their partner or family, and make delusional accusations. Before discussing the treatment plan, I wanted to discuss an article by Veronica Mead Kelly of Broad Institute Communications called "The Researchers Shed New Light on Schizophrenia" in 2014, in which a study is done by Harvard and MIT, Harvard-affiliated Massachusetts General Hospital, and other institutions from across the world that have helped to identify more than 100 locations in human genomes associated with the risk of developing schizophrenia. The study found that treatment points to biological factors that may lead to new approaches to drug development that hasn't changed in more than 60 years. Unfortunately, the price of treating schizophrenia is estimated at more than $60 billion annually in the U.S. alone. Stephen Ripke, a scientist at the Broad Stanley Center for Psychiatric Research and a member of Harvard Medical School, stated that by identifying which genes are known to work together to perform specific functions in the brain will help to understand the biology of schizophrenia. I thought that article was very helpful in understanding schizophrenia's background. Now for treatment plan. From a family therapist-based treatment, I chose to use cognitive behavioral therapy instead of the previous therapy treatments from my previous courses, as I didn't feel they were applicable form of treatment for schizophrenics, that which was strategic therapy and narrative therapy. So in an article by Cynthia Dopke and Catherine Botchka, Cognitive Behavioral Therapy for Individuals with Schizophrenia, a Recovery Approach in 2014, the recovery usually happens in different stages. According to the article, it also indicates that schizophrenic person defines their life by acknowledging their illness, and their character is based on the perceived stigma that they receive based on this illness. Dopka and Bachka indicate that the sufferer sees themselves very differently than others, see themselves and how they see others. The illness is very disruptive to their life, their future plans, their families. And in the movie, Nash is able to learn to cope with his illness despite that he still sees his delusions. However, once he's diagnosed with schizophrenia, he then considers himself to be crazy. Let's see, and he's accepted his illness to the point that later in the movie there is a scene that shows Nash approached by someone, and Nash is unsure if this is a hallucination or not, so he actually asks one of his students if they see this person as well, and of course the student says yes, and what we come to find out is this person is a representative of the Nobel Prize Commission. Now, cognitive behavioral therapy has helped to improve self-esteem and strengths based on the recovery models. It also helps schizophrenic patients view themselves in a very more healthy light instead of seeing themselves as crazy, restoring their self-esteem, which most tend to lose due to their illness. It tends to cause a loss of self-esteem. A form of cognitive behavioral therapy was used in the late 1950s. It wasn't considered called that at that time, but then it found a strong place in marriage and family therapy later and developed itself in the 1970s and is considered more of an umbrella to other therapy treatments that we know of today. The goal of treatment for cognitive behavioral therapy with schizophrenic patients is to change their thoughts, feelings, and behaviors as a result of their illness. I'm going to refer to cognitive behavior therapy as CBT from this point forward. So CBT can be used with a range of disorders and is meant for more of a short-term therapy of no more than 6 months, but can be longer and can continue on. During treatment, therapists set goals with the patient in short, medium, and long terms, broken into several parts, including their thoughts, feelings, behaviors, and reactions. And in the case of schizophrenics, this includes their hallucinations, delusions, and any abnormal behaviors they have experienced, and can also include any isolating feelings and behaviors. CBT is an effective method for schizophrenia and can be combined with medication. Both work to improve the symptoms with realization there will not be a cure. Nash is a prime example of learning to cope with his illness and how he reacts to his own thoughts and hallucinations, delusions, because later he mentions he is on better medication, even though he still sees Parcher, Charles, and Marcy. He just chooses to ignore them. CBT allows the client to use self-reflection, and it is evident that Nash consistently works at his own illness throughout the end of the movie. Although CBT is not a cure, it does provide a lot of help and provides the patient with skills to deal with their illness. Diagnosing schizophrenia and seeking treatment is extremely important as soon as possible. Evidence shows that without treatment, the longer it will take the patient to get better once the treatment starts, and symptoms will worsen over the course of illness if left untreated. Initially, I would recommend for Dr. Nash to be admitted into an inpatient facility so he can come to understand his illness and the effects it has on his life and that of his family. I would also recommend medication. Medication is critical for the best management of the illness. Studies show patients who do not take medication on a regular basis tend to relapse at a higher rate, are hospitalized more often, and suicide rates increase. CBT is largely based on the values supported by our dominant culture in the United States. These values include assertiveness, personal independence, verbal ability, logic, and behavior changes. During the time of Nash, the late 40s through 60s, and then later on in the movie in the current 1990s through present time, different types of interventions were applied based on what the information therapists knew about the illness. Nash experienced several different types of treatment, from insulin-induced comas to electroshock therapy to different types of medication. One intervention that I would use for CBT would be to set a system of goals, short-term, medium, and long-term. Short-term goals for Dr. Nash would include setting realistic goals and learning how to solve the problems that he's had, such as engaging in more social activities, learning how to be more assertive, also learning how to manage stress and anxiety, learning how to use maybe some relaxation techniques, coping with self-talk, etc. Also identifying situations that are often avoided and gradually approaching those feared situations. This would be associated with social withdrawal for Nash and how he can make changes to be more social. As in the beginning of the movie, Nash is seen going to a bar with only Charles, but later confines himself to his offices and home. Also identifying, engaging in enjoyable activities such as hobbies, social activities, and possibly exercise. I know that in the movie it doesn't show Dr. Nash exercising, but I did find some research that said that he walked to school every day. Medium-term goals would include identifying and challenging his negative thoughts. And for Nash, this would include his delusions and hallucinations, just helping reinforce what's real and what's not real. Keeping track of his feelings and thoughts and behaviors to become aware of symptoms and to make it easier to change his thoughts and behaviors for him to understand what he's seeing, what he's not seeing, and when he's seeing it. Also to help identify specific triggers that cause more of his hallucinations. The movie doesn't depict he sees more hallucinations, but that possibility is there for anyone suffering schizophrenia. Long-term goals would include exploring the positive and negative consequences of taking their medication on a regular basis, self-monitoring to recognize different behaviors, Identifying high-risk situations that would continue the hallucinations if this is a possible situation, and developing strategies for coping with and avoiding those high-risk situations that may trigger new hallucinations or old hallucinations. Another intervention would include Alicia and their children to set a system of goals to help Nash with his illness and with the family. In the movie, Alicia recognizes the changes in Nash's behavior and helps him receive treatment, even if this is against his will. And later, during another break, she consults Dr. Rosen for further treatment. This is when Nash does fully recognize that his hallucinations are not real. The interventions with Alicia would be similar to the goals for Nash, including the short-term goals, which is setting realistic goals and learning how to solve problems, which would be keeping Nash engaged in some social activities, learning how to manage his stress and anxiety, which would be recognizes his behaviors of stress, stressful situations that may cause his illness disturbances, identifying and engaging in enjoyable activities together to reinforce that Alicia is real, such as hobbies, social activities, and exercise. Alicia is seen doing this several times after he's been diagnosed with schizophrenia, so I would continue something like that. Medium-term goals would be keeping track of different events that have changed Nash's feelings, thoughts, behaviors, and become aware of symptoms to make it easier to change those thoughts and behaviors in the future. Identify specific triggers that cause more of the hallucinations. And long-term goals would include tracking whether Nash is taking his medication regularly, recording long-term activities and the responses with different behaviors, identifying high-risk situations for continued hallucinations, again, if that is even possible, and developing strategies for coping with and avoiding any high-risk situations for Nash and the family. Cognitive behavioral strategies for psychosis illnesses such as schizophrenia are based on the theory that learning is a process, such as reinforcement and conditioning play an important role in the development of coping with hallucinations and delusions. People learn to identify and change problem behaviors by applying a range of different skills that can be used to reduce or slow the schizophrenic behaviors. Because Nash is more of a chronic paranoid schizophrenic, he will need repeated interventions along with medication to maintain a stable life. I would refer to Nash to a psychotherapist for long-term treatment because it would provide better control of his negative symptoms and reduced isolation. I would also recommend social skills training to reduce his withdrawal by focusing on conversation skills and personal relationships. Schizophrenia is not just a single person's illness, but it involves the entire family. And Nash is a family man, and his family is going through this illness with him. And cognitive behavioral therapy will indeed help the family deal with the illness as well as a whole family unit. This concludes my assessment. I want to thank you for your time, and thank you for your time on my character treatment plan of Dr. John Nash Jr. in the movie A Beautiful Mind. Thank you.